Hi, my name is Dr. Anoki Khanam from the Apple Tree Pediatrics, and I am here today to talk to you about breastfeeding and weaning of your newborn baby. A newborn baby needs to be exclusively breastfed every 2 hours for at least the first month of life. Thereafter, the breastfeeding should be spread out to every 3 to 4 hours. You must remember, this is all new for you and your child. Therefore, it is not uncommon that in the first week of life that the baby actually loses weight. Mom is not producing enough milk. Baby, even though born with the reflexes to suck, still has to learn the coordination. One should not worry. Your baby usually is born with reserves, keeping this in mind. As long as the weight loss is less than 10 to 12%, it is considered in the normal range and your baby has enough reserves to keep them going. Anything beyond that does require further investigation, even though in most cases, weight loss is still due to insufficient feeding. I usually advise parents to go see their local pediatrician a day or two after birth, so that your pediatrician gets to know your child and also that your baby gets to be weighed and measured. Following which, to ensure that your baby is putting on weight, I usually advise to repeat a visit in a week's time, which is usually in our clinic is just a call and a walk-in just for a weight. Doesn't require a physician review. Exclusive breastfeeding is recommended for the first 6 months of life and thereafter for at least up to a year after introducing solid foods. Despite being exclusively breastfed, it is recommended also that all babies receive vitamin D supplementation. Unfortunately, research has shown that breast milk does not have sufficient amounts to be absorbed or taken up by the child. Vitamin D deficiency is linked to poor growth and development of the bones of the newborn. But also there have been recent research which has shown links between vitamin D deficiency in childhood and the association with increased risk of viral infections, as well as long-term risks of cardiovascular disease and type 2 diabetes. So when do I start weaning my child? It is not advisable to start weaning your child before the 5th month of age. Early weaning has been associated with increased risk of gastrointestinal infections and conditions. Remember, your child is learning to feed. It is a new motoric skill that needs to be developed. So give them time. Start with a few spoonfuls. Give them a spoon, give them a bowl, give them a food, let them make a mess. Let them enjoy themselves, let them explore. At this age, exploration takes place with their hands and with their mouths. Not so much with their eyes and hands as it does with adults. When weaning your child after your child is fully on solids, it is advised to switch the breast to a cup or a glass. Avoid bottles. Again, I must stress that your child should be solely breastfed for the first 6 months of their life. If for any reason you do require to wean your child before they start solids, there are ways of doing it. Firstly, you give them a feed before they're hungry. So before even they ask for the breast, you have fed them. Under 6 months, it is advisable to give a bottle. You should not be having a cup or a spoon. Second trick, get someone else to feed them if it's a bottle. Another method is to make sure you first feed them expressed breast milk before introducing formula. In older children above 6 months, try a cup with 2 handles. But again, I must stress, under 6 months, it is strongly recommended to exclusively breastfeed your child. So the energy requirements of your child changes as they grow up. It's usually higher when they are younger. So in the first 2 months of age, the energy requirement is usually 100 to 110 kilocalories per kilo per day. And by the time they reach 9 to 11 months, the daily calorie requirement is about 80 to 90 kilocalories per kilo per day. Infants have an innate ability to self-regulate their energy requirements. So your child will know how much food they require. It is your job to differentiate whether this is a cry because of a dirty diaper, a cry because of exhaustion, or a cry because of hunger. So just to summarize, your baby should be exclusively breastfed for the first 6 months of life. You know they're ready to wean onto solids when they are able to hold their heads upright, and they're being able to be sat upright with support. And don't forget, keep it simple. Make it easy, keep it simple, okay? And no honey before the age of 1 year. My name is Dr. Anoki Khanum from the Apple Tree Pediatrics. Thank you.